Good morning, and thank you very much indeed for inviting me. I'm absolutely delighted to be here. I'm going to talk about keeping us healthy, really, at work, and well-being and our mental health is going to be absolutely essential to this. When I first got involved in this whole sort of sector, which was 2006, I had a great deal of difficulty engaging people. I think they thought I'd gone over to the dark side, you know. What is this physician doing now talking us things about which we perhaps do not have as much evidence? And I remember how difficult it was to really get the CBI to really think this was top of the agenda, or even near top of the agenda. And I've been so delighted that over the last few years, they have increasingly seen that our health at work is crucial. And I've just taken from this report, but where they say workplace health is essential to us being able to compete and perform very well, both nationally and on the international stage. Now, what keeps us from work? This will be no surprise to you. The two big things, and do note I haven't put diseases, are mental ill health, mild mental ill health, as we've heard, stress, anxiety, mild depression, followed quite closely by musculoskeletal problems. And often what you see on a sick note is, you know, a person can't come to work because of stress, never says on the sick note, and hates the line manager. Never. But of course it would be helpful if it did, because this is a hugely complex issue. And when people take time off work, there may be a health problem, there may be back pain, there may be some stress, but what we really have to ask is why. And that's why the second group on this slide is hugely important, the quality of work. I'm going to talk quite a lot about good work and good workplaces. Are you listened to at work? Do you have any control in your workplace? These are the things that keep us well and mentally well at work. And if you're in a place where there's the absence of good work, then you quite likely will take sick leave because you're stressed and anxious. Of course, there are other important reasons that are serious, proper illnesses like cancer, like diabetes. But remember, the two biggest ones are symptoms. Stress is not a disease, it's a symptom. Back pain is not a disease, it's a symptom. And we ought to be able to deal with them. So just if we take the mental health symptoms, these are very common, we all feel them. There's nothing unusual about being anxious, stressed, and at times reacting and being depressed because of things that have gone on in your life. There are no objective signs. When you examine a person, you can't get an objective disease. It's not in front of you. If you order an X-ray or a test, you don't get a positive result. And we all get these, and we're essentially whole people. So why can't we deal with them? Why are they top of our list for people leaving the workplace and maybe leaving it for a few weeks, then a few more weeks, and then more permanently? And you can, of course, introduce all kinds of treatment. You may be given drugs, you may get CBT. They may indeed be helpful. But if somebody hasn't asked the real question, is why are you not going to work? Then it's like being on a hamster wheel, so we'll get your symptoms better. We then send you back to a toxic situation, and you, of course, will leave it again. So this is a truly important thing about asking the right question, not just taking at face value what is written on that medical certificate. Wherever you go now around the world, mental health has become hugely important. It's crucially important to most governments in developed countries because they know it's really often top of the list for why sickness absence is so large. So it's a growing global problem. And it's an issue that's really been neglected for too long. Most governments in developed countries have tried very hard to look after people with serious enduring mental illness. So, for example, schizophrenia or bipolar disorders. And often resources have gone into looking after people with those conditions. But the cost of mental ill health for the individual, the employer, and society are very large. And the ILO estimates the cost conservatively at 3 to 4% of GDP in the EU. So these are not small costs. And if you look at those who we might define as having serious mental ill health, a moderate disorder, or perhaps very little or indeed no mental disorder, then it's no surprise to you that lost working days, working less hours, accomplishing less are all the more serious and the longer that you have had this condition. So there is a productivity loss associated with all of this. Our mental health is so intimately connected to our sense of well-being. So to feel really well, you have to feel psychologically well. And of course, well-being is very closely associated with whether we're prepared to be engaged at work. And approximately 25% of the variation in reported levels of employee productivity is related to our psychological well-being. So this is crucially important. So when you think well-being, think psychological or psychosocial health, and think engagement. And really, high levels of staff engagement are not really sustainable. You can push it for a little while. You can try and drive it for a little while, but it's not sustainable unless well-being is maintained. And so trying to think about these three things all together, I think, is very important. And if you're not convinced that this has an economic cost, then we can look at the bottom line as shown to us by the NICE publication. It is a few years old now, but it was a very good publication on mental health in the workplace. And they calculated that for a company of about 1,000 employees, a mental health cost around $835,000 per year. And you wouldn't have to do that much to really improve on that. A reduction by 30% through taking simple steps would save $250,000 a year. So this whole area of mental ill health and ensuring that people are in good psychological health is crucially important. Now, there are lots of key players to do this, and this morning I can't possibly talk about them all. I'm really going to concentrate on employers, although I do just want to say a little bit about health professionals. But all of these are crucial, and we have to get them all lined up, because if you just get one part of this triangle working, but the others aren't working in synergy, then you don't get such good results. And yesterday, I went to the launch of the OECD's new report on mental health and work. They reviewed 9 countries. I would suggest you read the executive summary. It is fantastic. It's 179 pages long. You will not wish to read 179 pages. I had to review it at the forum. But what I'm missing from this slide, and I'm certainly going to correct my slide, but I realized yesterday, and they gave us very good evidence, that people's mental ill health, their anxiety, their stress, doesn't actually start when they go to work. It starts and is often visible at school. So we can't do the whole of this unless we really start to get schools and educational organizations really in on this whole agenda. They showed us very, very good evidence that if you are a school child who is stressed and anxious, unless someone really listens to that, pays attention to it, you may well take that into your life as you go on and into your working environment. So it is really more complex than I think we had ever thought. But these crucial interfaces are these interfaces of the employee who might become the patient, the GP, usually it is a GP, and the employer. And it's trying to get those relationships sorted out that is so very, very crucial. And I think the essential enablers of health and well-being and building your resilience are, I've tried to put on this slide. You may wish to add others, or you may disagree. You may not like some of these. But I can't stress too much early intervention. Waiting until somebody is really sick is not going to give you the best results. You need good work and good workplaces. You need to ensure that you have got good occupational health. As many people will know, I've said for many years that we want occupational health that is fit for the 21st century and meets the needs of your working place. So often, we buy occupational health in a package that is what a company might wish to sell us. But I believe you should be stating quite clearly what the needs of your workers are, and that the packages should be designed to you and not the other way around. I think that is absolutely, crucially important. And just this one slide about health professionals, and this, I'm not just talking about doctors. Nurses can have an incredible influence on someone who's off sick. The physiotherapist can, the occupational therapist can, but we have to make this cultural move and then a move in behavior of seeing that returning someone to work and to their normal function is part of a clinical encounter. Until we get our health professionals thinking when they see you in their surgery or you go to a hospital appointment that somebody doesn't just worry about your diagnosis and treatment, but worries about whether they are returning you to your normal life, to your functional life, then I think they have not been a good professional. Because we should look at this holistically. I won't say more about that now, but I think this is crucially important and a very important part of the jigsaw puzzle. Early intervention, I think, will and could come in the form of the new Fit for Work service, which is now available in Scotland through the NHS. This, of course, is a service that came out of the report that David Scott and I did for the UK government. In 2011, it was published. It's only just now that the government's response has been translated into action, and they have developed and designed an early intervention program which is there to try and see people very early on in their journey of sickness absence and to provide the advice and support to get people back to work. When we were doing this report, we had to make it 4 weeks, that's when the service would kick in. That's when the GP could refer. We did ask that employers could also be able to refer. I often think referral before 4 weeks is necessary, but we couldn't find the evidence for the Treasury, and we had to persuade the Treasury. And if there was no research to show us convincingly that intervening much earlier was appropriate and should be paid for at a national level, then we couldn't get it to happen. So it is at the 4-week point. And in Scotland, as I said, it will be delivered through the NHS. The whole point is to intervene early, to give appropriate advice. It is by professionals, not all medically qualified. I don't think that's necessary, but professionals who have a knowledge of occupational health. And we've specifically asked that they should have extra training in mental health, because we thought mental health and musculoskeletal problems would be the biggest things that would come and should come to this service. We did not anticipate referral to this service would be for people who were seriously ill, let's say had a cancer illness or just had a major road traffic accident. This service might be useful when they were in the recovery phase. And we thought that if it did work for early intervention, perhaps it could work to help people at a later stage. Okay, it doesn't want to work. These are the figures that the government produced for Scotland, and you can see there the number of days that are lost. You can see the cost, 15 billion, and you can see what was estimated that could be saved in Scotland to reduce employer sickness pay costs by a third, reduce costs of out-of-work benefits by a third to 6 million per year, etc. So this is the hope. And of course, it's very early days, but that should help. I had to bring this paper to you. I'm sorry, it is a bit of an academic paper, but it's great. It is from Scotland. Ewan MacDonald was one of the really driving forces behind this paper, because at last we've got some very good evidence that much earlier intervention is appropriate. I wish we'd had this paper when we wrote our report. It was called EASY. It was a service that compared NHS Scotland to Lanarkshire, and although this is a very complicated figure, it's a figure taken from this paper. The really important things to note are that when the study started, Lanarkshire had a higher sickness absence level than the NHS overall. The service was introduced, you can see at the top, the red arrow, easy service introduced on day 1 of absence, if possible. Sometimes it was day 2 and occasionally day 3, but the aim was absolutely day 1. And then you can see gradually, and I've highlighted it with a red arrow there, in 2009, the Lanarkshire figures were better than NHS Scotland. The rates came down below those in the rest of Scotland for the first time. Although the effect of doing this very interesting study was that NHS Scotland also improved. I think because they knew it was happening with a particular intervention in Lanarkshire, they also absolutely upped their game. And so what this study, which is a very good study, has shown is that if you intervene in day 1 appropriately, then you can help people return to work. And I carefully use the word appropriately, because of course it must be absolutely appropriate. But you can see that initially the MSKs and the mental health problems accounted for 23 and 19% of days lost, and they reduced over this time. The MSKs really had a very nice reduction of days lost year on year. So I think it has shown us that you can intervene early and you can show a return on that investment. So I think that is important. Another thing I would stress about this, you must not, of course, in doing this, lose the line manager involvement. And that might be because it's a telephone service, you're phoning out of the organization. I think that is something to be careful about. I mentioned good workplaces. These are crucial to our well-being, and if we don't have them, we really do not have a sense of well-being. I've listed some of the things that I think are important, and I will, if I may, just mention a few of them. So, leadership, and that has been mentioned earlier by Peter. Leadership is absolutely crucial, and you can demonstrate leadership in many ways. I've just taken an example from the NHS in England. This is York NHS Foundation Trust, and what they did. And they've had a program that really started in about 2006, so it's been a gradual journey, but they absolutely ensured that a non-exec on the board had the responsibility for the health and well-being of the staff of the hospital, in as much as they took the figures to the board, they sat on or chaired the Health and Wellbeing Committee. They were visibly involved in everything the Trust did to improve the health and well-being of the staff. So board leadership is one way of doing this. It is important. You can see it also had some very good effects on sickness absence, with a reduction of 2.7 million. So board leadership. Another kind of leadership, of course, is individual leadership. And I like this, this piece of work. It's from Scandinavia. The Scandinavians have been very, very much in the forefront of doing appropriate practical research that gives us some useful things which we can act on. Here they were looking at the predictors of back pain. As you might think, the predictor of back pain is, have you slipped a disc? Have you been cleaning the car or doing too much gardening, etc.? But in this paper, which is scientifically a very good paper with all the relevant adjustments, well, it wasn't that at all. It was, do you have any decision control at work? Do you have empowering leadership? Or do you have fair leadership at work? So again, it's what's written on the sick note may have nothing to do with the real cause. And therefore, other questions must be asked. And leadership is absolutely crucial. We do not have a sense of well-being if our managers do not treat us well. And now that is well recorded in the literature. This again is taken from Scandinavia. It's in a Danish public sector institution in local government. And their staff were totally disengaged. They didn't really have clarity about their work. They were just simply not doing very well. The intervention was an exceedingly simple one, but they did a control arm too. So they did something which you could really trust. It was a proper study. And the intervention was just really paying attention to improve teamwork, but also giving individuals more control. So the control was hugely important. And then the question they asked was, if the managers supported that intervention and were seen to be proactive about it, did it make a difference? So the active group had that. The control group, the managers were asked not to do anything. They weren't to show any interest in that. And you can see there, using a particular kind of modeling, that the active middle manager involvement was perceived by the employees as helping their sense of well-being and job satisfaction. So again, we're coming down to really your well-being is so very much influenced by your leaders and by your line managers. So whatever one does, one should train one's line managers very well in people management. We appoint people because they're technically competent. But do we really do these things? Do we ensure that when we give them these appointments, we then ensure that they've got the tools to really work with people? Do we make sure that they are effective communicators, not in the technical sense? Are they developing an open culture? Because although I'm not going to talk about it this morning, stigma at work is so important to mental health. We know that there's a lot of that still around. So training managers, learning enough about mental health just to know when someone is not okay. Not trying to make anyone a psychologist, but just learning about that. And ensuring that when someone comes back to work, perhaps they've been off for 6 months with depression, that the group and the team to which they go back into is primed enough to be able to understand this and cope with it. That is crucially important. We do this very well if somebody's had their knee replaced. We all can do it quite naturally because we sort of say, is your seat comfortable? You know, can I do anything for you? We can chatter on about that. But how many of us feel comfortable when someone comes back after 6 months off with depression? I think it's much more difficult, whoever we are. And therefore, I think this is important. The Time to Change campaign, the anti-stigma campaign, has been looking at the public attitude towards mental health. And there was a 7% rise in a recent analysis of willingness to work with someone with a mental health problem. But this reintegration after mental illness, I think, is important. Also, rising up the agenda is this integration of conventional occupational health and safety. People often say to me, oh, well, you don't pay enough attention to the conventional sort of HSE regulations, the safety stuff. And the integration of that, which is what we must do, and in no way am I trying to take away from that, but do you integrate that with the promotion of health and the prevention of ill health? Is the well-being over there in the corner, your OH over here, your HR over here, your managers over here, and your sort of safety regulation over here? Well, if it is, you never get the maximum benefit from investing in well-being. It must be really integrated. And I like to think about that as total worker health. And it's described very well in the American Institute for Occupational Safety and Health. And they annually have a wonderful conference on total worker health where they bring all this very much together. So it's easy to say, I can stand here and say this. This is really very difficult to do. But really, the reason to do it is on this slide, that if you do the conventional stuff, that's under the horizontal line. If you like the illness, injury, incidents, minimizing them, harm minimization, your compliance to systems and processes, you will get so far. You will certainly do quite a lot. And people will, of course, be physically safe. But if you want to get gains in health and well-being and resilience, then you've got to integrate and do the other, and then it will go up above that horizontal line where the absence of illness and injury is important, and cost minimization about those things important. So integration, crucial, but not easy to do. Often asked, does it matter which health and well-being program you put in? I would say no. What matters is you ask your workers, because it varies. It varies depending on which sector you're in. Some employees in an organization will put at the top of their list one thing, others will put at their list others. So it doesn't matter, but it does matter that you've asked and you build it around your employees. And I think this is a crucially important point. Don't forget the people at the bottom of the triangle. The people at the top of the triangle here in a pyramidal organization really often have more opportunity to be in better health. They earn more. They live in better houses. They will often live in a better part of a city. They often will take themselves to the gym. So they are often more concerned about their own well-being and health. But as you come down that triangle, there's usually a decrease in income and a decline in health. And yet you need to include everyone at the bottom of that triangle and to ensure they have the same opportunities. And that can be really quite challenging. And also, if you don't, you won't get maximum performance from the organization. And a really nice demonstration of this is what's called measuring your heart age. Unilever developed this tool. It measures heart age. It's a simple online tool in which you put things like your blood pressure and your cholesterol level, and it'll tell you whether your heart is your age, is it older than you, or is it younger than you? Well, we'd all like our hearts to be younger than us. That's what we would like. But look at the difference between the market site, where there will be more people doing office jobs, there will be the senior managers, etc., and the factory site. Anything this side of those squares means your heart is older than you are, and anything going to the other side of the north. So heart age above your actual is in each of those squares this side, and you can see that there is a difference. So the people who are, if you like, perhaps in the better jobs, on the whole, have a better heart age. So do remember that, whatever you put in health and well-being. And there are cynics who say, well, don't know that it does anything at all. This just happens to be a very good study that looked, they did a systematic survey of many, many articles, and they came up with what they thought were the best, and they then tried to say what is best and promising practice, and to say when it will work. So it works if the goals you have are aligned to your business, it's evidence-based, and ongoing evaluation. So there is now, at least, again, and really Peter talked to this ongoing need for us to design and secure an evidence base. I wanted just to draw to your attention, because it's just come out in the last week or two. This is the King's Fund new report on NHS staff engagement. We know that in our hospitals, staff engagement equals mortality. So the lower your engagement score, the higher the mortality in hospitals. We know that that is true. And engaged staff are much more likely to have the emotional resource to deal with the very difficult jobs they do. And what they've done in this report, and I thought it was quite useful, it was a very easy report to read, and it was very easy to understand their building blocks. They described these building blocks, the 6 building blocks, for a highly engaged workforce, and none of them will be a surprise to you. Again, on the board agenda, supportive styles, having a distributive leadership, etc. But that is quite a good report that has just come out. And measuring and evaluation is truly important. I've just taken this one from RBS, and you can see there in this slide the difference between the top 10% engagement in 370 of their anonymized business units compared to the bottom 10%. And if you look at sales versus target performance, 117% versus 63%, voluntary turnover, 5% versus 10%. And just remember, I said you can't have engagement without well-being. So it all, where the time is bringing us back to well-being. And I took a lot of interest when the Olympic site was being built, because they had on site a wonderful occupational health provision for the workers. It was probably the best I've ever seen on a construction site. And it really, it showed how if you look after the workers, they will build something for you safely. There was not a death on the Olympic site, and they will do it very, very efficiently. The accident frequency rate at the Olympic Park was 0.17 per 100,000 hours worked, which was less than half the average for the construction industry. And they attributed that in part to the engagement of their staff. And they took a lot of trouble to look after the well-being of the staff who built the Olympic Park. So I think that is important too. And on the other side, if you're not engaged, then you can see that it costs a lot of money, estimated that it costs business dearly, about 6 billion, equivalent to 0.4% of GDP from the UK economy in 2012. And if people aren't engaged and motivated, why should I go the extra mile? Will anybody ever thank me or acknowledge it? Just moving towards the end, I wanted to say 1 or 2 words about good work, because it's not about how much you earn. That may be important, but it's not the sort of thing that will eventually make you be at work. It's being safe. I don't think either of the things I've put on that slide are safe. I wouldn't like to be right at the top of a skyscraper, and I wouldn't like to be the soldier holding the thing for someone to shoot, to learn how to shoot into. But the thing I really wanted to tell you about was my train driver, because he taught me a great deal about control at work. When I became National Director for Health and Work, I asked the Department of Health, could I go and join people who I thought had boring jobs? Because I wanted to know how they managed. How did they retain an interest in their work? And I said, could I join a train driver on the Underground? So I joined the early shift. I joined my train driver at Baker Street Tube Station at 5 a.m. in the morning, and we were to go up and down the Bakerloo line. And I sat next to him in his little cabin. I got rather bored at going up and down the Bakerloo line. So I said, well, could we do the Jubilee line or perhaps the Central line? And I said, and what about you having the opportunity to do the afternoon shift or even the evening shift? And I said, even better, what about 3 weeks driving underground and a week above ground? Because that would be variety. And anyway, above ground, you might see a little bit of daylight. He got very irritated with me. And when he dropped me off, he simply said to me, look, this is my train. I'm in charge. Anything that happens on this train, the safety of the people behind me, is my responsibility. I mean, it really said it all. And he said, and I like this shift. It suits my family. I like the Bakerloo line. We're a team. We cover for each other. If somebody's got to go to the hospital, I like my mates. I've got good occupational health, and I'm reasonably paid, so go away. Really was what he said to me. And really that taught me a huge amount about what gives you a sense of well-being at work. And the other example I wanted to bring you was a great learning curve for me. I was giving away some awards, national awards to companies, and this was the company that won the small and medium company award. They were a group of 100 dockers in the port of Blythe in Northumbria. They had a new chief executive who considered these men who had really physical jobs. He considered that they weren't very fit. He thought they were rather overweight and that they didn't have good enough food. They didn't exercise very much. And he worried that they would lose their jobs really due to physical ill health by the time they were in their early 50s. So he was concerned to be able to give them an extended working life. So he didn't ask them what they wanted. He introduced all sorts of good things, like healthier food was made available, bicycle schemes, reduced gym membership. And they said, no, we don't want any of this. Go away. This is not what we want. When he said, what do you want? It was a huge learning curve for him, and it was the reason they really won this award. Many of those men couldn't read and write properly. So they wanted numeracy skills. They wanted to be upskilled for themselves and their families. So he went back. He arranged the relevant courses, literacy, numeracy. He tried to build this skills gap. 2 years later, they formed a football team. They actually themselves, once they had got what was most necessary to them, they then were prepared to think about the things that he wanted. Those two examples of control and my little company up in the north were really, really very important. So I think the sequence really is if you provide good work and good workplaces, you will, with all that means, get employee well-being and engagement. That will lead to the things that companies want, productivity or quality of product or reduced staff turnover. It will, and then if we get a lot of that, improve our economic performance. And I do think it is good for a safe and stable society. So I hope I've given you some thoughts as to what well-being is all about, and perhaps some of those thoughts are not the quite obvious ones. And I'm very happy to take any questions.